going to talk to you about the symptoms, transmission, and prevention of Salmonella. So, the clinical symptoms of Salmonella are going to include diarrhea, nausea, fever, abdominal cramps, and vomiting. And so this happens typically 12 to 72 hours after the bacteria enters the body. And while this infection is typically not fatal, it can cause severe dehydration and in some cases hospitalization. This illness is most common in younger children, older adults, and those who have weaker immune systems, and this is just because their body has a hard time fighting off this bacteria. And so the sickness can last anywhere from a few days to a week, and symptoms go away on their own. And then because Salmonella, the symptoms of this illness typically resemble the stomach flu, Salmonella cases are sometimes overlooked and they're labeled as the stomach flu. And so modes of transmission. The most common mode of transmission of Salmonella is through the food we eat. And so specifically raw meat, raw poultry, fruits, vegetables, and raw eggs. And you're probably thinking, why would I eat a raw egg? But raw eggs are in things like cookie dough and cake batter, and so next time you go to lick the bowl, just be careful and be aware that salmonella poisoning is something that can happen. And so it's also possible to get salmonella through cross-contamination when playing with animals who are known to carry the bacteria. So these are going to be animals like turtles and birds, and they have the salmonella bacteria on like the outside, and so like you'll touch them and then maybe you'll go touch the food you eat or like touch a doorknob or something, and so it just spreads the bacteria like that. And then the last mode of transmission I'm going to talk about is travel. And so if you're planning to travel to places that have poor sanitation, just be careful of what you're eating and drinking because it's possible to get salmonella when the sanitation is not a priority there. So they're like not taking the proper measures to prevent salmonella from spreading. And so just a little graph of foods associated with salmonella outbreaks. The most common food associated is poultry, and that's going to be 29% of the cases reported from 2004 to 2008. And then we're looking at raw eggs being the next most common, pork, beef, and then fruits and vegetables. And then others are going to include things like sprouts, leafy greens, roots, fish, grain beans, shellfish, oil, sugar, and dairy. And so this just breaks down like where the salmonella is coming from our food. And so now I'm going to talk about the different levels of prevention for salmonella. And so primary prevention is all about preventing the disease and spreading knowledge. So for example, this presentation I'm giving you could be an example of primary prevention because I'm informing you about the illness and how to prevent it. So in regards to salmonella, primary prevention is going to include cooking food all the way through, and I'm specifically talking about meat here. So for example, chicken should always be cooked to an internal temperature of 165 degrees, and that kills the bacteria. And so also keeping a clean food prep area will prevent the spread of salmonella across your kitchen surfaces. And if you ever find yourself playing with a turtle, or if you have a pet turtle, just make sure that you wash your hands after to prevent the spread of the salmonella bacteria. So secondary prevention comes into play once you have contracted the infectious agent. And so now you have salmonella poisoning. What happens next? Antibiotics are not going to work here because they just make the salmonella bacteria want to grow more. So this is not going to be part of your treatment routine. Unfortunately, there is not much that you can do for salmonella, and you'll just have to make sure that you are drinking plenty of water and staying hydrated while the sickness runs its course. Symptoms should not last more than a week though, so that's a positive, I guess, if you want to say. Tertiary prevention is all about improving the quality of life and reducing symptoms. So this level of prevention doesn't really apply to salmonella because salmonella is not a lifetime disease, and as mentioned before, it should go away in about a week or so. But for really severe cases, people will have to go to the hospital for an IV drip because they've just become so dehydrated. In addition, the Department of Agriculture has came up with a plan known as the Salmonella Action Plan, and the whole point of this plan is to improve the poultry slaughter system in hopes of reducing cross-contamination and making sure that um, organizations that deal with poultry slaughter are following proper sanitation procedures to prevent the spread of salmonella. And so that was my presentation. I hope you guys learned a lot about preventing salmonella. Thanks.